A new science, barely a decade old, is creating man-made tissues and organs. Replacement body parts coming soon from a laboratory near you.
The heart, which up to now has been essentially straight, begins to change shape and bends slightly to the right of the body of the embryo.
I'm Parmin Sedigh, and I'm an undergraduate student in my second year at the University of Toronto.
I'm Paul Knoepfler. I'm a professor at UC Davis School of Medicine and a cancer and stem cell researcher.
Amazing. So jumping right in, let's start off with a discussion of what goes on in the heart in humans. So first off, what are the different cell types that are in the heart?
Yeah, so the heart is actually developmentally, it's almost like a specialized form of blood vessel that's contiguous, with all the other vasculature in the body. And so there aren't actually a ton of different cell types. Some organs have many different cell types, but the heart is fairly homogeneous. So it mainly is consisting of what are called cardiomyocytes. Those are heart muscle cells, and they're the ones that contract, as the heart is beating. And then there are also structural cells called fibroblasts that are making up kind of like the architecture of the rest of the heart. It's like a scaffold that keeps the heart in the proper shape and everything. So those are the two main cell types, so the cardiomyocytes and the fibroblasts. But then weaving through the whole heart are all these blood vessels, of course. So the heart is pumping blood out to the rest of the body, but then the heart itself also needs blood. So some of the blood comes back into the heart through coronary vessels. So the heart has many different size blood vessels in it too. And so looking at the heart as a whole, if you add up all the blood vessels, and there are actually a lot of cells from those blood vessels. And the blood vessels consist of endothelial cells, they're called, which wrap around the inside of all those blood vessels, kind of keeping the blood in the right place and controlling, how open or closed those vessels might be. There are also cells called smooth muscle cells, which is a different kind of muscle, pretty different than cardiac muscle. And then on the outside of each blood vessel, there are something called pericytes, not to be confused with parasites, but pericytes are actually a cell type, and they seem to have a function to wrap around the outside of little and large blood vessels. I think they help control the shape, but there is thought to be some stem cell-like function to pericytes. But just to be clear, the stem cell function seems to be related to growing more blood vessel cells. So like if there's an injury to a small vessel, like in the heart, it's possible that pericytes can make more smooth muscle cells, possibly more endothelial cells. There's also nervous system tissue that goes through the heart as well. So there are some nerve cells, and then the heart has its own special conduction system, that controls the beating of the heart. And so there's some specialized cells in the heart related to actually transmitting electrical signals.
Yeah. And in terms of the kind of breakdown of the cell types, is it mostly cardiomyocytes with some fibroblasts? What does that kind of look like?
Yeah, I think it is mostly cardiomyocytes. I don't know the exact ratio. One thing to note is the cardiomyocytes are these huge cells, whereas the fibroblasts are relatively smaller. And so I do think the cardiomyocytes make up more of the actual volume of the heart. But by numbers, it would be an interesting study to do. I don't know if anyone's ever done that, because I've seen these interesting lab experiments where they've kind of tried to decellularize the whole heart and just leave the fibrous connective tissue part left. And there's a surprising amount of that left, and that is coming from the fibroblasts. So there might be more fibroblasts in there than we think, but I think by volume, most of it is muscle.
No, that's really interesting. And then the topic of this video is obviously heart disease, but that is a very broad term and encompasses a lot of different diseases. So could you talk about some of the most common ones, and then also how the cell types we talked about are kind of implicated in those diseases?
Sure. I think the one that most of us bring to mind when we hear heart disease is like a heart attack, and so, or a myocardial infarction is the technical term. And so here again, we talked about like the heart having its own blood vessels and needing blood to come back to itself. In a heart attack, as many people probably know or recall, like some of those blood vessels get sort of occluded and less blood can go through. And at some point there gets to be sort of a critical event where maybe a clot comes in, and closes off the shrinking space. And essentially the heart's deprived of the blood that it needs to function. And some of the heart is actually destroyed, killed. And so when that happens, a lot of those cardiomyocytes we were talking about, they literally just die. They're very sensitive cells. They're very metabolically active, so they need blood flow, they need oxygen. And so there isn't a lot that the body can do, unfortunately, to repair that. So yeah, I think the main injury there is to the actual cardiomyocytes. Another fairly common thing is just a very general term called heart failure, which, as the name implies, the heart starts failing to be able to pump enough blood, that the body needs and that the heart itself needs. And so heart failure can have many different causes. A heart attack can later lead to heart failure because some of that muscle has died and the heart as a pump is not working as well. There are other causes of heart failure as well, like over time, the wall of the heart can thicken up and there can be less room for blood inside the heart and it may not beat as well. So that's actually fairly common, especially as people age. Another common category, probably the third main one, is arrhythmias. So there, the heart, maybe the muscle is fine and there's no thickening, and it's not failing, because it's functioning okay, but it's not beating properly. And it may be that it's beating too fast or too slow, or the beating is not synchronous.
And then based on this, what's kind of the underlying theory behind how stem cell therapies could help with the different types of heart disease?
Yeah, that's a great question. I think the main one is that maybe we could replace some of the muscle that was lost, say, during a heart attack. I think that's one of the main ideas out there. And so let's say someone had a heart attack and 30% of their entire heart muscle died, which sounds pretty scary, but that can happen. The idea would be to replace some of that 30%. Maybe you can't replace all of it, but if you could even replace 10 out of the 30, like 1/3 of the 30% that was lost, that might make a huge difference for the person. There are other ideas related to treating heart disease as well. Like there might be ways to, say a person has an arrhythmia, you might be able to ablate the existing part of the existing conduction system and then replace it with one that will function properly. Very big, difficult challenge given the complexity of sort of the electrical system in the heart. I've also seen a lot of people talking about trying to treat heart failure with stem cells as well. And there it kind of depends on the type of heart failure that one is talking about, because like if it's secondary to a heart attack, again, the idea I think would be to replace some of the lost muscle, some of those cardiomyocytes. But if there's a lot of wall thickening, like the heart failure is not that the heart partially died, but like the walls are just getting too thick. That seems a little harder for me to try to fix with stem cells just because there's too much of something there, right? And oftentimes we think of stem cells going in there and building new tissues. So I think a lot, when it comes to heart failure, a lot's going to depend on, what's causing the heart failure.
No, that makes a lot of sense. And then kind of delving deeper into the therapies and the trials and some of the basic science models as well. What are kind of the biggest hurdles that researchers have run into that they need to overcome before stem cell-derived therapies could actually more widely help with heart disease, especially with heart attacks, as you were mentioning?
Yeah, I think unfortunately, there are quite a few hurdles, so it makes it hard. I think one of them is based on an idea that was around for decades, that the heart has its own endogenous stem cells. And so there was a lot of hope, especially say like 20, 30 years ago, if we could kind of mobilize the heart's own stem cells, that would be the best way to use regenerative medicine to fix the heart. So if we go back to the sort of example case we had where someone lost 30% of their heart muscle due to a heart attack, people used to think maybe if we could treat that heart, say with growth factors or something like that, rather than putting actual stem cells in, the heart might just regrow its own muscle cells, and replace a lot of the lost muscle. But sadly, it seems like the heart doesn't have a significant population of its own stem cells. There's been a lot of back and forth on that over the years and discussion, and even some, unfortunately, some like misconduct related to research. And so I think that's one of the hurdles that the sort of cell therapy for heart disease field has had to overcome is, yeah, we probably can't rely on endogenous heart cells to fix the adult human heart because there just aren't enough of them. Some people think there really aren't any, perhaps beyond those pericytes, which are not really heart stem cells, but like more like blood vessel stem cells. Now I think there has been sort of a bounce back from that for the field. Like there's some hope that different approaches might be useful for using regenerative medicine to fix hearts. But I think that was a setback for the field, just to practically speaking, and then also just sort of the related to trust and things like that as well. So I think that's one hurdle. And then a very different kind of category of hurdles is more technical, which is like delivery. So people talk about using different kinds of cells to fix hearts. But I think one of the big problems is like, how do you actually get cells into the heart and have them stay there? So for example, you could imagine just having a syringe filled with cells, say stem cells of some kind, and you literally just jab it into the heart muscle and inject, say, 30 milliliters of some solution with cells in it right into the heart muscle. So you can imagine the heart's also going to be beating during this time unless you take the risk to stop the heart during that procedure, which seems pretty scary to me. So let's assume the heart's beating, you stick a needle in, you inject some cells. The way I envision it, a lot of the cells are just going to pop right back out. The heart's this, hard muscular kind of tissue. So there are ways, I've heard of ways people hope to get the cells to stay put. Like they can inject them when in sort of a presence of like a gel. So it's not just like a liquid that would pop right back out. And so it might stay in place, but I think even in that scenario, there are a lot of potential sort of secondary challenges. Like, are you getting the cells in the right place? Are they going to stay put, not only pop out of the heart, but stay put in the heart in the right place? And then the other thing is, say you're successful and those hypothetical cells could grow new cardiomyocytes. Are you getting them, exactly where you need them, and will they integrate properly? Could they cause arrhythmias? That's a possibility because the heart, again, has this sort of very complex electrical system that's actually the cells, different kinds of cells. So putting cells in sort of willy-nilly or even in a very careful way, you might still get them not in the right place. The other main delivery approach I've seen is also got its challenges. And so that idea is to actually take, again, let's say we've got a syringe or we've got an IV bag of liquid with cells in it. Instead of putting it into the heart muscle, they put it into the heart's blood vessels, which are those coronary arteries. And so the idea is that the cells in those coronary arteries will go into the actual heart muscle, go into capillaries and kind of percolate into the tissue. So, you could see how that could potentially be helpful, but the cells don't necessarily stay put that way either, right? They're going to mix in with blood that's in those coronary arteries, and blood only stays in the heart for a relatively short period of time. And so as the heart's beating and blood then exits the heart, you're hopeful, healing stem cells, a lot of them probably just go out with the blood, right? And just enter the general circulation. So there again, I think people are sort of scratching their heads like, how could we maybe get them to stick around in the heart tissue longer and, and do helpful things. So another challenging delivery approach. And then finally, there are even trials, and I've seen papers where people just, go IV into a vein in the arm with cells of some kind, perhaps stem cells or MSCs. And then those just go into the whole circulation. And I think part of what people who are testing that kind of approach invoke is this idea if the heart is diseased, the stem cells kind of home into that area, even though they are just going into the blood, and the blood, there's liters and liters of blood. And so you're kind of diluting your therapy. The idea is that the damaged heart will kind of be like a magnet for those cells, and they'll migrate there and stay there and do something useful, like maybe reduce inflammation, or some people claim that maybe the cells home in there and then can grow new cardiomyocytes. So I think each delivery approach, unfortunately, is not entirely optimal, right? And there's sort of pros and cons. So that definitely makes things more difficult. Yeah, there's another challenge that sort of comes out of left field. Like we've been talking a lot about technical challenges and different research challenges, but another challenge that really is prominent for me as someone who follows different elements of the stem cell field are what we call stem cell clinics. And these are direct-to-consumer clinics that market different kinds of cell therapies. Oftentimes they call them stem cells, even if they're not actual stem cells. And so unfortunately, a lot of these clinics market supposed treatments for heart disease. And this is something we've seen grow widely across the US and also Canada and in other countries. There's so many clinics claiming they can treat, say, a dozen different things with one kind of stem cell or cell therapy like MSCs or something like that. And so I do oftentimes hear from patients who reach out to me asking different questions. One of the questions they ask about is stem cells for different kinds of heart disease, whether it's for themselves or, say, a parent or a grandparent, something like that. And unfortunately, there are no approved, really clearly effective and safe stem cell therapies for heart disease, but these clinics are marketing what seem to be scientifically unproven and usually non-approved, meaning regulators have not approved these therapies. Many people are in a sort of desperate or vulnerable state, and they're looking for things to give them hope. And so that's a challenge as someone doing educational outreach, because sometimes I know that some of the people who are asking questions, it's hard for them to hear a discouraging answer. And so they may still go on and go to a clinic or encourage, a family member to go to one of these clinics. And I really don't see that they're going to be helped. Say they had a heart attack or they have heart failure. I don't see the clinics selling various kinds of MSCs or other kinds of cells really giving them any true hope. And so that's very sad, because the people involved may lose a lot of money. I've heard people say that they've mortgaged their house, they've done all these fundraisers, and people have given them, $10,000, $20,000, like through GoFundMe or something like that. And it all goes to the clinic, and the clinics are not really doing research for the most part, and they're just trying to make money. So it can be a sad element to the educational outreach work that I do, to see a lot of people being taken advantage that way.
You've also alluded throughout to the different cell types that are used in the therapies. So what are kind of the ones that are using the most promising therapies? Is it mostly cardiomyocytes? Is it like a mixture of different cell types that are used?
Yeah, there's actually hundreds of trials that are testing different kinds of cell therapies for different forms of heart disease. And there's sort of this steady stream of papers that come out using different products, different cell types. So one of the ones that's the most common interestingly, is bone marrow cells. And there's this idea that somehow bone marrow cells, when put into the heart, might be helpful. And those cells could be bone marrow mesenchymal kind of cells, like bone marrow MSC-like cells. They could be bone marrow, other kinds of bone marrow cells, like more like blood cells. The part of the problem, it gets back to what we were talking about earlier, is that, to repair a heart, oftentimes you're trying to have cardiomyocytes come in there, like new heart muscle cells. And so there's really no good evidence that bone marrow cells can form new cardiomyocytes. So in that case, you have to invoke some other scenario, like those cells will reduce inflammation in a damaged heart, and that could help, healing. That's a tough thing to argue if the patient, say, had a heart attack 4 years ago or something like that, because probably the inflammation component of the damage has largely already happened, and there may not be much remaining inflammation. Yeah, so I think I personally have a harder time seeing how marrow cells are going to help heart disease. There are other kinds of MSCs that also are being studied, like adipose MSCs. There are people who claim that adipose MSCs might be useful for heart disease, and so they're testing them. So those adipose MSCs are kind of like relatives of the bone marrow MSCs, but have some different properties, mostly the same. So there again, some of the same issues come up. Like I don't see that as particularly promising. There are different teams around the world doing what I do see as more promising research on this, which is to actually try to make cardiomyocytes, like say in the lab, and then transplant those into the heart. And that seems really interesting to me. I've seen people talking about different ways of trying to do that. The area that seems most exciting to me is something called like a patch, like a stem cell patch or a heart patch. And different teams are working on that. And so there, the idea is that rather than putting the cells, say, just into your vein in your arm or putting them into coronary arteries or sticking a needle into the heart muscle, you're going to make this patch, and it might be, like a few centimeters square or something like that, or it's probably more likely round. You're going to make that in the lab from stem cells, and it's going to consist mostly of cardiomyocytes. And then you're going to apply that, say, to the outside of the heart, where, let's say, the heart was damaged by a heart attack. You're going to put this patch on, and you're going to actually attach it to the outside of the heart. So this is really, in a sense, another delivery approach that to me seems more promising. And then that patch is going, since it has, say, let's just throw a number out, 100 million cardiomyocytes are in this patch that you bioengineered in the lab. That actually is the cell type that, in many cases, we want to get into the heart to try to fix it. So you might put it right where the most damage is, and those cardiomyocytes, the hope is that they could help with the beating, of the heart and replace some of the lost muscle. I do think the heart patch is pretty neat, but it has its own challenges. Like, you could potentially cause arrhythmias by putting a new patch of new cells onto the heart. You can imagine the conduction system might be altered. Also, will that new patch, again, say it has a significant number of cardiomyocytes, is that enough to really boost, say, the efficient beating of an entire giant heart? Maybe it could be. I don't know. And there's definitely trial work going on in that area. I guess the other thing to mention is that after a heart attack, there's a lot of scarring that can happen. And so that mostly consists of fibroblasts. So there's some sense that scarring is not just sort of a neutral thing, but actually can be harmful. Like, all those excess fibroblasts in scar tissue is actually impeding the proper function of the heart. So I've also heard people talking about, like, could there be ways to reduce the scarring? And that, I don't know exactly how that would work. Like, could there be some growth factor treatment that gets rid of fibroblasts? Or, perhaps even later out, long after a heart attack, maybe there still is some underlying inflammation. And if you could reduce that, some of the scarring might, sort of also be reduced. So that's another interesting thing I've heard talked about in this space.
And in terms of like the more promising approaches, like the patch that you were talking about, how far along kind of are we in testing that? Is it like moved into animal trials, or is it still more like the preliminary phases?
No, I think it's pretty far along. I think if I remember right, there actually are some human clinical trials that have started in that area, at least one. And I don't remember off the top of my head who's leading that trial, but I definitely have seen that discussed. And I think there might be one trial in Japan, and there might be some other ones as well. So some of these things are actually pretty far along. I know just from talking to people who work in the cardiac cell therapy arena that there's some frustration, that things are taking a long time, and there have been these sort of ups and downs and misconduct by, a major lab and things like that. So it definitely is like a marathon for some of these researchers, and I admire their persistence to kind of keep going at it and come up with new ideas. And, if data are not so strong with a prevailing idea, like the heart having its own stem cells, maybe you have to set that aside and devote resources, to some other newer approach.